I welcome everyone here on the HPV vaccination session of the WCPAG Congress. And I'm Dr. Zsolt Krasznai from Debrecen, Hungary. And we thank everybody for coming to the session, and I welcome all presenters. And as opening, we could as well open the session, if you agree. Opening the session, I would like to call Olga Kciuk, I'm sorry, the first presenter.
That's perfect. That's better than I say it.
Thank you. to present a lecture on human papillomavirus immunization in childhood cancer survivors. Thank you very much.
Thank you. Good afternoon, everyone. Hope everyone is feeling good after lunch. I am a pediatric and adolescent gynecology fellow at Stanford. I'll be speaking today about HPV immunization in childhood cancer survivors, as promised. I have nothing to disclose. Each year, about 400,000 children under the age of 19 are diagnosed with cancer, most commonly leukemias, lymphomas, brain cancers, solid tumors. Survival rates for childhood cancers vary quite widely across the globe. And in high-income countries, we see over 80% survival rates. And for those patients who do survive a childhood cancer, there are lifelong health consequences, and that includes an increased risk of subsequent malignancy. Pertinently to us in gynecology, studies have shown an almost threefold increased risk of developing an HPV-related subsequent malignancy. As we know, that includes over 90% of cervical and anal cancers, in addition to vulvar, vaginal, oropharyngeal, and penile cancers. Relative excess of these is seen in the childhood cancer survivor population. And for those childhood cancer survivors who are diagnosed with HPV-related cancer later on in life, age at diagnosis actually tends to be younger than their previously healthy counterparts, and that's even after controlling for screening. Interestingly, this risk is seen regardless of whether patients underwent chemotherapy or radiation, and one hypothesis is that the immune dysfunction related to accelerated aging may be driving both increased risks. Of course, I don't have to tell anybody in this room, HPV vaccination is a well-studied intervention, decreases the risk of HPV dysplasia and malignancy. And the good news is that immunogenicity studies of the HPV vaccine have shown an equally robust response in childhood cancer survivors as in control patients with no history of cancer. The bad news is that HPV immunization rates in childhood cancer survivors who are eligible to receive it may be lower than in the general population. This survey study showed only a 24% initiation rate in American cancer survivors compared to 41% in the general population. And supporting that as well was a single institution study in the United States that found low vaccination rates, 48% in females, 29% in males, for their population of adolescent and young adult cancer survivors, lower than US population estimates of 63% for females, 50% for males at that time. On the other hand, a study of cancer survivors who were participating in a survivorship clinic in the United States found no difference in HPV vaccination coverage between their group and control patients without a cancer history. So the question's been raised about whether this gap may be partly mediated by participation in a survivorship clinic. In our own institution, which is a tertiary referral center with a survivorship clinic, a de-identified cohort search of our electronic health records over the last 10 years revealed that out of 6,660 male and female patients who were diagnosed with any malignancy before the age of 21, just under 5% were recorded as receiving an HPV vaccine at any age at our institution. But immunization can be completed in other settings as well, including primary care, so we know that we're not getting the whole story here. We took a very broad look at the distribution of some demographic aspects of those two groups who did or did not receive the HPV vaccine in our institution, for example, race, ethnicity, language. And these graphs are small because we don't actually have to go through them in too much detail. Ultimately, they reflect our patient population demographics at Stanford, rather than giving us any real information on differences between these groups. But seeing this institutional data and also bringing it together with our own anecdotal experience helped us to generate our hypothesis that HPV vaccination is being missed in childhood cancer survivors in our area, and that this effect is mediated and in fact exaggerated by socioeconomic, sociocultural factors. So to test this hypothesis, we have an upcoming population-based study planned. I'm going to take my last few minutes to tell you about. So we aim to use population-based statewide vaccine record data, first of all, to characterize prevalence of HPV vaccine initiation in childhood cancer survivors, and then to understand factors that are associated with initiation of the vaccine for this population. We're going to use records from the California Cancer Registry, the California Immunization Registry, and the Cal and VirusScreen database, and link those records, then perform a multivariate regression, and use that to identify factors that may make a childhood cancer survivor more or less likely to initiate HPV vaccination. And that includes factors like age at cancer diagnosis, sex, race, ethnicity, rural or urban address, and socioeconomic status quintile, public versus private insurance, and linguistic isolation, which is a census-level measure of of the percent of households with low English proficiency in the census tract. In terms of some take-home points for today, so survivors of childhood cancer are at an increased risk of developing subsequent HPV-related malignancy. HPV immunization rates in this population may be lagging in the United States. And I told you about our upcoming population-based analysis of HPV immunization for childhood cancer survivors in California, with a hope that we can encourage collaboration with oncology and primary care fields to improve HPV protection in this high-risk group. Thank you.
Yes, we have 2 minutes for quick questions. If
no questions from the audience, just one comment on on your work. Congratulations, and I think the study of these factors, that how you could improve this in cancer survival population, is very important. What do you think? Why is only 41% of this age group is immunized? That's my first question. In the general population, is it only there are no campaign vaccinations on the age group in the US? This is one question.
Big question.
No? And the other question is maybe if there are, then these cancer survivors miss them because of their cancer in that age group, or it has no link at all?
So in the United States, primarily immunization happens in the primary care setting. There are, definitely campaigns around education for providers and for families alike. But certainly still a population, even in the general population, we're working on increasing those rates. In cancer survivors in particular, even if the cancer diagnosis itself is not happening at the age of eligibility for HPV vaccination, these are people who tend to have long follow-up with oncology. And there is some early qualitative work being done in this area that sort of is revealing this maybe gap of scope or perceived gap in scope, where oncologists think that immunization is going to happen in the primary care setting. Maybe primary care physicians think that oncology has the best, grasp on this patient's complex cancer history. Patients in these qualitative studies are looking to their oncologists for HPV vaccination recommendations. And so I think that it's important to continue to collaborate and drive that education.
Thank you very much again.
Thank you.
And congratulations. Thank you, and I would like to introduce the next speaker, Victoria Jovanovska, and she's going to be talking about knowledge gaps and knowledge acquisition of HPV infection and HPV vaccines among medical students in North Macedonia. Thank you very much.
Good afternoon. Dear esteemed colleagues, I am Dr. Natasha Ilieva, an obstetrics and gynecology specialist from Skopje, Macedonia. And today, on behalf of the author, I'm honored to present an insightful study exploring the understanding and knowledge gaps concerning HPV infection and HPV vaccines among medical students in North Macedonia. Before I delve into the presentation, I would like to express my sincere gratitude to share with you this insightful study. And by examining actually the knowledge gaps and the process of knowledge acquisition, we aim to shed light on areas of improvement for medical education in relation to HPV, ultimately aiding in the effort to enhance prevention and early detection strategies for HPV-related diseases in the future. HPV infection is a sexually transmitted infection, which, due to its prevalence, potential oncogenicity, and the asymptomatic nature, remains significant public health concern. And with the high-risk HPV strains, which are causing several cancers, and number one for women is cervical cancer, as we all know, and this period of progression from HPV-related HPV infection to cervical cancer usually takes more than a decade, so that is actually excellent period of time for us healthcare professionals to undertake some of the tools that we have. So primary prevention, HPV vaccines, secondary prevention, screening, pap smear, LBC, and HPV testing. I would like to emphasize that despite the proven efficacy, we have remaining the disparity of HPV vaccine coverage with a great challenge for all of us as healthcare professionals for improving these numbers, low numbers of HPV vaccine coverage in low-income countries. Now I would focus on our study. So the study objective of the research is to evaluate the knowledge level and knowledge acquisition of HPV infection and HPV vaccination among medical students, adolescents, and young adults in North Macedonia. So this is a cross-sectional questionnaire survey which include medical students as participants. They were divided in two groups, adolescents, those in the basic cycle, and young adults in their final cycle. All of them were from the medical faculties of our two main universities in the country. So one in the capital of the country, Skopje, and the other in Štip. All of the participants completed an anonymous confidential 10-minute questionnaire. This was a reference questionnaire which was modified and accustomed to our research, and a good level of knowledge was considered if 80% of the questions were correct. And knowledge acquisition was considered when adolescent knowledge was less than 80% and young adults' knowledge was above 80%. So the main outcome measures are data on knowledge about HPV infection and HPV vaccines, barriers, and acceptability of the vaccines. What have we found? So we have proven the internal consistency of the instrument, and we got responses from 207 medical students, 58.5% of them were adolescents and 41.5% young adults. Most of them were female with Macedonian nationality, and 83.5% got their knowledge from school. Higher knowledge gaps were assessed among female medical students and among adolescents. Regarding the knowledge acquisition, we found that it was inadequate in the following questions, mainly referring to HPV vaccine. Can smoking increase the risk of cervical cancer? Should the HPV vaccine be given before the first sexual intercourse? Can the HPV vaccine cause infection? Is the HPV vaccine provided by the government? Is the HPV vaccine part of the girls' immunization record? Are 3 doses required for complete HPV vaccination? And do you think the HPV vaccine will stimulate the onset of sexual activity at an earlier age? Let's see what the other studies actually say. We have here 2 very important and sensitive populations, so adolescents and medical students matching, and in the research studies, it is proven that their knowledge and acquisition of HPV infection and HPV vaccines in adolescents remains low. Girls are usually more informed than boys, and the level of education is an important factor for parents. So usually for adolescents, the main source of information is school, then TV advertisements, internet, clinicians, and for parents, they choose as healthcare professionals as the first choice. And all of these studies give appeal to reevaluate the delivery of HPV education, and that including school-based health education programs has proven to be effective. So these are just the references of what I have just said. On the left side, Zhang with collaborators has done a multi-center intervention follow-up study, which actually proves the low level of knowledge in Chinese adolescents, and also they have included the school-based health education, has proven as very effective in improving awareness. Patel, in its systematic review, focuses on European adolescents, and they are also appealing for re-evaluation of the education program in order to improve their knowledge. These are Roseanne in its study focuses on main sources of information, and Gomez in actually researches in Brazilian adolescents on this topic, and they have proven that girls knew more than the topic than boys. Regarding medical students, so it is very important that this group of people have solid knowledge and a positive attitude. So they, together with us as healthcare professionals, they will be the future, actually, providers of health services, and they could be of great help in favorable outlook of screening and vaccination programs, and it is necessary for them to have proper training on this. So low level of knowledge on HPV infection and HPV vaccines among medical students across the globe is proven. That is on the left side. On the right side is the only study that was before ours for our country. And here are emphasized the knowledge gaps that are noticed in males and adolescents and the ones that are not vaccinated. More education and training on this topic to be included in the curriculum for medical students. So as a takeaway message, I would like to conclude that knowledge level of medical students should be improved, particularly among adolescents, as well as their knowledge acquisition during medical studies. These future healthcare specialists have an essential role in raising awareness on HPV infection and its primary tool of prevention, HPV vaccine. Thank you very much for your attention.
Are there any questions for audience? Yes, please.
So, very nice, thank you for presenting. We know in general that girls are more likely to have been vaccinated themselves, and so it would make sense that someone who has themselves been vaccinated might have more knowledge. Did you correlate, was one of the things that you looked at whether the students themselves had been vaccinated?
Yes. The latest data from our country is that 45% of in Macedonia. So in Macedonia, it is obligatory for girls only. So we have only they are in the immunization program, and 40% are fully vaccinated. So this is not from our study, but yes, we have asked them also. So the percentage is around 37% of them were vaccinated. Yes.
So about the same as the general
Yes.
population,
Yes.
more likely, which we would hope.
Yes, and I can see because I'm a teaching assistant, and I can see that when they are very, very interested in the topic and they are keen to know more, but actually the education program, I believe that it should be included much more earlier in their studies and not in the final cycle of their studies, 5th or 6th year. Because actually a lot of their friends and family members refer to someone who is studying medicine. So this is even in the earlier, I think that in before medical faculty, these educational programs need to be much improved than now.
Thank you very much. I'm sorry, you said obligatory. Is it obligatory or offered?
It is
in a
offered.
campaign?
It is
It
offered,
so it's
but
not obligatory.
I mean, it is included in the immunization program. So
So it's included in the program, but they
Yes.
can take it voluntarily.
yes, yes,
That's the
yes,
same
yes.
as in most countries. Thank you very much again.
Thank you.
Thank you. And I would like to ask our next presenter, Ilma Dacic, to hold her lecture on current genotypical HPV vaccination coverage among females in Canton Sarajevo, Bosnia and Herzegovina. Please. Thank you very much.
Greetings, dear colleagues. My name is Ilma Dadic, and I'm currently working as a family care physician at a primary care institution in Sarajevo, Bosnia and Herzegovina. So the aim of our study was to assess current genotypical HPV vaccination coverage among females in Canton Sarajevo. As we know, HPV, or human papillomaviruses, can be divided into two subgroups: those non-oncogenic of low risk, causing usually genital warts, and those oncogenic of high risk that are in 99% of cases the cause of cervical cancer and other carcinomas of the anogenital region. So our study was conducted as a cross-sectional study at the Institution for Gynecology, Perinatology and Infertility Mehmet Basic. We used real-time PCR to detect HPV strains of high risk, potentially high risk, or low risk in cervical swabs. Out of total 1,517 patients, 43% of them tested HPV positive and the rest were negative. Of all the HPV positive patients, 59% of them were infected with only one type of the virus, while 40% were infected with multiple virus strains. Here on this chart, we can see the specific HPV strains that were identified among these patients. HPV type 16 was most frequently detected. Majority of patients were infected with HPV type 16 or HPV type 18 in combination with other strains. Regarding HPV vaccines, there are currently 3 types of vaccines available, those protecting against 9 types of the virus, 4 or 2 types of the virus. HPV vaccination in Sarajevo Canton just started last year, so 2022, as a pilot project, and a quadrivalent HPV vaccine protecting against types 6, 11, 16, and 18 is being administered to girls aged 11 to 26. So, as we saw previously, HPV type 16 was detected in 22.5% of the cases, HPV type 18 in 5.1% of the cases. So, based on the most common HPV types among females in Canton Sarajevo over a 10-year period from January 2012 until December 2021, we predicted that if vaccinated with this quadrivalent HPV vaccine, 27.6% of patients would be protected against high-risk strains of HPV. So it is our hope to encourage the authorities and epidemiological centers to make more detailed analysis of the study of our own population when planning future vaccination programs. Thank you.
Congratulations. Any questions on the lecture? I would have a few. First thing is that what was the selection criteria for the women tested for HPV?
Women that came in for routine gynecological examination.
And 50-something% of them was HPV?
57% were negative, 43 were positive.
But that's quite high.
Yes,
Yeah. In
really
an
high.
age group up to 20?
18 to 65.
So, not in a under 30 age group, it was a
no,
general age
it
group.
was 18 to 65.
Because it's
yes.
remarkably high.
Yes, because we just started the vaccination program.
Okay, that's okay, but we would expect
So,
lower.
yeah, I know, but
that's perfectly okay until like 25 years of age, but it's quite high if there are.
If the age
do you know
group is so big, yes.
What was the age population? So the majority were younger or older, or do you have any information on that?
I think the median age was 33.
Okay, thank you very much. And the other thing is that I completely agree with your result. Only a comment that it would be even much higher percent that would profit from this vaccination, because that's only momentarily. So probably even more people would get infected with 16 or
Yes.
18 type or the
Yes.
other types if it's a throughout lifetime
So
or
we
throughout
don't have,
years.
I would
It
just
was-
like to say, we don't have like a unique database for the whole country. This is only the capital, the Canton Sarajevo, and a private institution. So because
Okay,
we don't have
that's
like
fine.
a national program or a national database or even a database that is official for our whole canton.
Could it be that these women were referred to this center because of some cytological atypia, and that's why it was selected?
No, because it
because-
is a private institution. They came in by themselves.
Okay,
It
so
is
it's
not
not.
usual to be referred to such kind of a
Okay,
center.
That's still quite high, but thank you very much, and that's a very important result. Thank you very much.
Thank you.
Thank you. Thank you very much for the lecture, and I would like to ask Ivana Todic to hold her lecture on knowledge and attitudes towards reproductive health and methods of contraception among adolescent students from nursing school. Please. Thank you very much.
Good afternoon, dear colleagues. I'm Ivana Todic, currently working as a OB/GYN resident at Clinical Hospital Center Zemun, and today I will talk about the knowledge and attitudes toward reproductive health and method of contraception among adolescent students. First, let's say why reproductive health is so important. Well, according to World Health Organization, it is a state of complete physical, psychological, and social well-being, and not just the absence of disease or discomfort in all matters related to reproductive health and its function. Maintaining of reproductive health is a fundamental right, as it's something that has to be available to both women and men in all ages. Today, we still have risk factors that are affecting reproductive health that are constantly increasing. First of all, we have to mention the high number of sexually transmitted diseases, especially in adolescents group. Also, we still have a high number of teen abortions and teen pregnancies, especially in low-income countries. Although in recent years there has been more talk about this topic, the lack of right information, poor health education, especially by health workers and school teachers, also unequal access to the health care and low vaccination rate with available vaccines like HPV are leading to the persistence of these problems. The aim of this study was to determine the awareness of reproductive health, general knowledge, and use of different contraceptive methods among adolescents, but also their familiarity with HPV vaccine and the way they are informing about previously mentioned. This was a cross-sectional study done in March 2023 in Belgrade. Study population were the students from one of the nursing school. And for data collecting, we use a specially created questionnaire that consisted of 13 questions that we can divide in 3 groups. First part was data that referred to our participants, like their age, sex, history of sexual intercourse, use of contraception, and history of sexually transmitted diseases. The second part of the questions were more about their general knowledge of different contraceptive methods, the way they are using contraceptions, and also the way they are informing about it. And the last part was about the HPV vaccine. Have they heard about it, from who, and are they vaccinated? The total number of participants was 125. Our participants were predominantly women, more than 70%. Their age range was from 15 to 19 years. And the good news is that among all the participants, only one girl had a history of sexually transmitted disease, and it was a genital herpes. Low percent of them had sexual intercourse, about 25% of them, but the good is that among them, almost all claimed that they use contraception, and we can see that everyone except one girl had used condom as a contraceptive method, and only one had used oral contraceptive pills. Here we have some graphs that show their knowledge about the contraception. We asked them to say with which contraceptive methods are they familiar with, and all participants were familiar with at least one contraceptive method, and in our case it was condom. Then we still have high rates of response to oral contraceptive pills and morning after pill, but they were less familiar with other contraceptive methods like intrauterine device and female condom that are not so common in this age group. The most common way of informing about this topic was via internet. More than 60% of them said that they are using internet to inform about contraception. And on the second place were friends. And we can see that less than 30% of information were given by health workers. Next slide shows some results about the HPV vaccine. Although more than 80% of the participants said that they heard about the existence of HPV vaccine, only 4% of them were vaccinated, and all among them were the girls. Among the ones who are unvaccinated, more than a half said that they are planning to vaccinate in the future. Like about the contraception, the most common way of informing about this topic was from friends and from internet, and here we even have a lower rate of information given by doctors. To conclude, our study showed that in this group there was a decent knowledge about contraceptive methods, but still the low awareness of importance and benefits of the HPV vaccine. Also, the study indicated the need of engaging doctors and school teachers in the process of educating adolescents. And I don't think just in sense, so they have to talk about more about this topic with them, but also to improve the informations that they are reading and getting through the social media, which they use the most. Thank you for your attention.
Thank you very much. Any questions on the lecture? Please.
Yeah.
So I noticed that 60% had gotten their information from the internet.
Yes.
But you were just looking at whether they kind of knew about this method at all, but not whether their information was accurate or not.
Yes, just the way they are getting information. Okay.
May I ask something? Are there, excellent.
Thank you.
presentation. Are there any differences between boys and girls in giving
No.
answers? Because in some other studies, boys tend more frequently to use internet. And girls,
Sorry. Okay.
And girls have information, and there are no parents there.
Yeah, we have a low rate of answers of giving information from the parents. The only difference that we saw is that the boys were the one who had more sexual intercourses than the women, and just a few more answers that they got information, for example, from health workers, was noticed from the women. There's no significant difference.
But I don't know the way you posed the questions. Was that a structured interview, open questions?
They had a list of the answers, so they were available to circle more than one answer, and also to add if they think there's something missing, or if they had, for example, other way of informing from the ones that we have mentioned in our questionnaire.
Excuse me, did you have the question where did they obtain? Did they have some lessons in school?
Yeah, we had options like internet, school, then family, friends, and the other. So they could write if they were using some other sources for informing.
No school.
You're welcome.
Thank you very much, and congratulations on the
Thank
lecture.
you.
One last question.
Oh, sorry.
I'm sorry, there was only one girl using the contraceptive pill.
Yeah,
or a
yeah,
contraceptive
that's
pill.
really,
That's quite rare
yes.
there, or that's. I'm from Hungary. That's much more common in this age group. at least half of them would be on the pill.
Yes, but I think, unfortunately, that in Serbia the situation is not same.
They do not want anybody to know about their relationship.
No, I think
not
they
the
are
doctor, or
still a bit suspicious because they are, I think, reading from the wrong sources, and they are afraid that the oral contraceptive pills will affect their health.
Okay, a Hungarian girl this age group would go to pediatric adolescent gynecologist or a general gynecologist, and that would prescribe her the pill if she wanted to, and she would want to. That's something they are afraid from the pill, or they do not want to make a contact with the doctor so that they wouldn't know they are having a relationship.
I think they are afraid to ask the things they are not so sure whether the pills will affect their health, or to get a better explanation of the way it's used.
Okay, thank you very much. Thank you. Please. And, thank you very much, and I would like to ask our last presenter, Edmoni Onitsarna, to hold her lecture on the HPV vaccination status among socio-economically deprived population in Greece and risk factors of non-vaccination. Thank you.
Hello, good afternoon. Actually, I'm Eleni Paschalidou.
Okay.
I will represent instead of Hermione. And I'm a gynecologist and pediatric and adolescent fellow in Areteu University Hospital in Athens. And I will present here the result from a cross-sectional study that was conducted in collaboration with General Hospital Agios Panteleimon in Nikia. And in this study, we examined HPV vaccination coverage in socioeconomically deprived population in Greece and risk factors for non-vaccination. We have no relevant conflict of interest to disclose. So, since 2020, WHO recommends that HPV vaccines should be included in all national immunization programs, and has set the goal of 90% vaccination coverage among all girls by the age of 15 by 2030. In Greece, HPV vaccines are fully funded by the Greek national health system since 2008. And in the beginning, young adults could also get vaccinated, but nowadays, HPV vaccine is funded for girls from 9 to 18 years old. According to data announced by the Ministry of Health between 2017 and 2021, 55.4% of girls aged from 11 to 18 years old were vaccinated, which is far less than the goal set by the WHO for 2030. So the aim of our study was to estimate the extent of vaccination in socioeconomically deprived population in Attica, in Greece, and to examine risk factors for non-vaccination. We included 809 women born between 1982 and 2008, for whom HPV vaccination has been funded by the National Health System. The recruitment took place at outpatient OB-GYN offices of General Hospital of Nikia, and data collection was achieved via structured interviews conducted by the department's midwives. So here you can see a map of Attica district in Greece, colored based on the Human Poverty Index. Red regions represent areas more socioeconomically deprived, with the darkest red representing the poorest 20% of Attica district population. The arrow marks the location of the hospital, and the circle, the areas where our patients predominantly reside. So to estimate vaccination coverage, we report frequency distribution, and to examine potential risk factors of non-vaccination, we applied the Chi-square test for categorical variables and the non-parametric Kruskal-Wallis rank sum test for continuous variables. So in our study population, only 22.3% were vaccinated against HPV, which we consider as an alarmingly low coverage. And vaccination coverage was even lower among women older than 20 years old at the time of interview. On the contrary, among girls less than 20 years old, vaccination coverage was almost 49%. With regard to potential risk factors for non-vaccination and the characteristics of non-vaccinated participants, we observed that non-vaccinated study participants were born earlier, were older at the time of the interview, had a lower educational level, were more likely to be unemployed, less likely to be insured, and more likely to be smokers compared to vaccinated study participants. Furthermore, women that were not vaccinated against HPV were less likely to be single and had greater parity and gravity status. Lastly, not vaccinated study participants were more likely to have breastfeed at the time of interview, less likely to use male condoms, more likely to use intrauterine devices and engage in intermittent sexual intercourse for contraception, but were more likely to have had at least one pap smear. No other examined variable differed significantly between the two groups, including, among others, alcohol consumption, illegal drugs, age at menarche and sexual debut, place of birth and nationality. So, in conclusion, among socioeconomically deprived population in Greece, vaccination coverage was low, but has improved among women below 20 years old, approaching the national vaccination coverage. However, women who are at higher risk of contracting HPV based on type of birth control they use and marital status, and developing cervical intraepithelial neoplasia and cancer based on smoking habits, were less likely to be vaccinated. Thank you for your attention.
Thank you very much and congratulations. Are there any questions to the lecturer? My question would be, that's quite a low general coverage, 40-something percent, if the vaccines are free and they are offered to a special age group. And do you see any national reason for that people are more, what their concerns about the vaccine? Or is it because, one thing, is it something they're afraid in the vaccine, from the vaccine, anything will happen from the vaccine? Is it cultural that it has to do with then they would have promiscuity or earlier sexual start or anything? Is there any thought behind that low national coverage that you think in general? Because these are very important data that you have presented, and it's very important that which age group was higher and was lower. But in general, the whole thing is low with 40-something percent. And is there something behind the whole thing in Greece? This is what I would like to ask.
Well, actually, in this population, because people don't have the correct access to the vaccines, because we have to remove more barriers and to make people more able to book an appointment and to get to the appointment. Sorry.
I understand. What do you mean by not getting the correct access if it's offered to?
It is offered, but these people are not getting the correct health. They're not coming so often to the hospital. They do not take care of their gynecological health, so they are not so informed about the correct reasons to be vaccinated.
So they would have to come for the vaccination to a hospital? For the offered vaccination? Is it done in schools or in primary care, or what's the...
It can be in primary care, but not all people have the access to that. And mostly we need more campaigns from doctors just to tell people how to be vaccinated.
And where are the campaign vaccinations done in Greece? Are they done in schools, or where is the shot given to the girls who are willing to take it?
I think mostly in schools.
Okay.
I think.
Thank you very much.
Thank
Any more questions? If not, then thank you very much. I would like to thank all presenters and the audience, and now we would close this session, and thank you very much. Where should we give this paper? What do you think?
And total score.
Total score, okay. And you will collect it?
One, two,
Yes,
three,
and
four,
total.